Hello. Hello, and welcome. So, this training is part of an endometriosis empowerment series that I'm hosting in honor of Endo Awareness Month this month in March as a way to teach and empower and spread awareness about endometriosis through masterclasses and podcasts. So, if you're listening on the podcast, welcome to the Endo Babe Podcast. If you're watching on YouTube or in the group, welcome to the masterclass. Today, I am so excited to share with you Dr. Amanda Olson. She is a pelvic floor physical therapist, and she is the president and chief clinical officer over at Intimate Rose. So you can find her at intimaterose.com, at Intimate Rose on Instagram. She is phenomenal. We're going to be chatting all about ways to manage pain with sex when you're living with endometriosis and really the importance of pelvic floor PT when you're managing sex with endo, right? Pain with sex in particular. She's also an instructor in the Academy for Public Health and on the faculty for the Endo Summit. She is amazing. You're going to love her. So let's get her to hop right on and let's dive in. All right. Welcome, Dr. Olson. I'm so excited to have you here for this training. What we're going to be talking about today is a little bit about the importance of pelvic floor PT and managing pain with sex. So welcome, Dr. Olson. I'm so excited you're here.
Thank you so much for having me. I always love being on your show and in your programming.
Yes, of course. And if you guys haven't listened to the previous podcast episode, I'll tag it below this, but we chatted all about pelvic floor PT. I think it was in July. So about 6 months ago. And yeah, so today we're going to be specifically talking about pain with sex. So let's just give everybody like a tiny little overview about who you are, what you do, just for people that missed the prior episode.
Sure. So I am a physical therapist and I am certified in pelvic floor rehabilitation. So I treat people of all different ages and backgrounds with various types of pelvic floor impairments. And that ranges from urinary incontinence to constipation to pelvic pain. And as our topic is today, pain with intercourse. So, and then additionally, I'm the president of Intimate Rose, where I create pelvic floor tools that help empower people to be able to manage their symptoms independently.
Yes, wonderful. And it's such a great resource that you have. Her website is chock full of free resources. So if you haven't checked her out already, hop on over there. She is phenomenal. You're going to love her.
Thank you so much.
Of course. So the first question I guess I have for you is how important is pelvic floor PT in mitigating and managing pain with sex?
Well, I'm partial, obviously, but I find that it is just such a helpful tool because we tend to be supportive of the person as a whole. And what that means is that when you come in and you're experiencing pain with sex, we're going to have a really in-depth conversation with you and ask a lot of questions that are pertinent to what may be contributing to that pain so that we can find the underlying factors and help address them. And then we're also, as a bunch, pelvic PT, pelvic OT, we just tend to be really supportive emotionally too and good at pulling in other professionals to help create a really robust team if you don't already have one in place. So it's possible, people come to pelvic physical therapy in different ways. Sometimes their doctor referred them and sometimes they are coming in open access because they've done some internet digging or they've heard from a friend or on an amazing podcast like yours that it's helpful. And sometimes when we're doing our evaluation and we're talking with someone, we identify that they may benefit from seeing a different kind of doctor additionally, or a certain type of counselor or therapist. So we work together as a team with other providers to help reach your goal.
Yeah, and that's so important, and especially with endometriosis, having a huge team of people behind you supporting you, because it's not just one thing that's going to help magically like fix all of your symptoms,
Yeah, 100%. And first and foremost, having a great physician or a gynecologist that truly understands endo. I mean, it's in this day and age, it's not enough to just have a good gynecologist. They really have to understand that disease process and be really up on the current research and all that to help provide a really good comprehensive care plan.
Yeah, I agree. And especially because like I've run into a lot of women and people that have had surgeries with doctors that said that they know about endometriosis, but they aren't up on the current research. And most of the research that's being done right now is like dramatically different than what's actually been taught before, you know?
Yes, there's a big discrepancy out there.
Yeah, there is. Um, it's it's insane. So thank you again for being here and for being one of the amazing like physicians on somebody's team. Like I can't imagine having you on my team as like a support person. So if you guys need a pelvic floor physical therapist, check out Dr. Olson.
Thank you.
Yeah. So I guess, do you have any tips for the listeners on like things that they need to do? So say that they have pain with sex and they've been diagnosed with endometriosis. What steps do they need to take in order to help alleviate and manage some of that pain?
Absolutely. So once they recognize that this is a problem for them and they're having this kind of difficulty, I do recommend first going and seeing a gynecologist specializing in endo to have an exam just to clear out any other underlying factors that could be more serious. So that's a really good place to start for somebody with endo, is to have it just a really nice thorough exam and then get the referral to come to pelvic physical therapy. So in that same breath, there's a lot of different modes of delivery now. So like a lot of pelvic health PTs are doing telehealth, and then a lot of them are seeing patients live. If you are able to, I highly recommend getting in for a live one-on-one in-person appointment, because as I mentioned, we're going to be going through your medical history. We're going to be asking a lot of questions about how your bowel movements are going, how your bladder is behaving. We'll ask questions about if the pain with sex is on entry or with deeper penetration. And all of this helps give us a better idea of, again, what those underlying impairments are. And so during that first appointment, we may or may not do an internal examination. The internal examination is an intravaginal exam. We don't use a speculum. We observe the outside of the vaginal opening. We ask questions about, is there pain located here and here? We try to get very specific about where the pain is. And then we do the same thing on the inside. And then we look and see how the muscles are responding, whether they're able to contract when we say contract, whether they're able to relax when they say relax. So this gives us an underlying knowledge and understanding of how your muscles are behaving in conjunction with all of the other organ functions. So the first step being seeing the physician and then coming into pelvic physical therapy. Oftentimes on that first appointment, we may ask you to keep a bladder diary for a couple days. As you know, bladder function in relation to endometriosis can be a very tricky thing. And oftentimes patients have pain in the bladder region. They may have interstitial cystitis. Additionally, commonly referred to as that evil twin syndrome. So getting information about how your bladder is doing is really helpful in creating that plan of care as well.
Yeah, 100%. And I do know so many women that have interstitial cystitis, and that initial assessment is so important, right? Because there are things in there that most people wouldn't like correlate with painful sex, right? Like the bladder and the bowels and like all of the things that are down in that area that the pelvic floor supports, right? And so getting a full history of everything is very important.
Yeah.
What is So say that they have pain on penetration, like on entry and not deep
Mm-hmm.
pelvic pain. Like what could somebody do for that?
So possible factors, and it is unique. Every person is so different. That's why we form that one-on-one relationship and ask so many questions. But possible drivers of that kind of initial penetration could be pain issues arriving from the vulva, the outside of the vaginal opening. It could also be that there are issues at the vestibule. That would be the opening itself. That in and of itself could be driven from muscle restriction. It could also be driven by the flora of part of the body. And so that's why I always recommend having a great physician on board, because they can be running those swabs and looking for the presence of bacteria and other things that can lead to irritation. They can feel like burning. It can feel like a zinging. It can feel like an itching. In that regard, to having that possible presence of that bacteria where that physician would be swabbing and testing for. Interestingly enough, muscle restriction in that superficial area can also feel like burning and itching. So when we have muscles that are really tight at the opening of the vagina, they can compress on the blood flow, the healthy arteries and veins and nerves in that area. And that can send kind of an itchy, nervy type sensation for some people. And that can create trying to have penetration, whether it's with a penis or a finger or a toy or something, a speculum, it can drive that painful sensation. So those would be factors that we're looking for if they were having pain on initial entry.
Yeah. And what can somebody do to kind of manage that pain or reduce it or like make it not so like bad, I guess?
Yeah, absolutely. So from a physical therapy perspective, so saying that bacteria and all that was cleared out and the flora looks good and we've identified that it's like a myofascial issue, the wand that I created is a really helpful tool. So some people may be listening and some people may be seeing on screen. So if this is the vaginal opening here, right, as you can see here on my model, right in through here, and you're having pain in the musculature that's right around the vagina, maybe coming up around the clitoral hood, using the wand to do some really gentle training, really, really gentle initially, to help release some of the tissue that may be tight in the area, especially down underneath here in this perineal body is one method. In physical therapy, we may be working on doing some manual therapy in that region, and then training your brain and your muscles to have good coordination and good communication. I often liken it to sometimes, the muscles can clench when you're unaware of it. And sometimes your brain may be saying, pelvic floor muscles, relax. And instead they clench. And so it's almost like your brain is speaking English and your pelvic floor is speaking French. They're not getting along. They don't understand each other, and they're trying,
Mm-hmm.
we don't want to blame ourselves or our muscles, but we do want to learn to have good coordination control. So we're thinking about relaxation and opening to allow for penetration, especially during sex, that those muscles know how to do that. They know how to relax and open. And so helpful training mechanisms for that are using a mirror so you can visually see it. Some people are visual learners. And so if I said bend your elbow, you could see your elbow move, and that's a really helpful training. Oh, I did it. Good. I did it properly. I can see that my elbow bent. But the pelvic floor muscles are much more subtle. So bringing a mirror down there and being able to observe in physical therapy, sometimes biofeedback is a helpful tool for training that as well. So that would be, sometimes we can put an electrode on and you can see on a screen, and you go through different exercises and watch how the muscles are behaving. Yeah, it's super fun. A lot of the programs have like really cute things, like they might have like a rose, and if you contract, the rose comes closed into a little bud. And if you're practicing on relaxing and opening, it blooms out into a rose. Or there's kids programs where it's like a little dolphin and you can make the dolphin jump, and it's pretty cute.
No, that's amazing. And I mean, especially for visual learners.
Yeah, exactly. And then for people that learn kinesthetically by feeling their body, you can place one finger onto that area and practice gently compressing down. It's not a big hold your breath and push down motion, but just learning how to drop that pelvic floor using touch and that tactile cueing to be helpful. So those are just some of the ways that we go about helping for superficial pain with penetration.
Yeah. And one of the things that I thought was amazing from our last podcast episode was when you were talking about like that gentle touch. You're saying like you're touching a tomato, right? Like you're not trying to like crush the tomato. It's like this little gentle touch. And it's just, I don't know, that was mind blowing for me. Like,
I'm so happy to hear that. Yes, because that's a really important concept in how we treat our muscles and our tissue. I think a lot of people think more is better. And if I can just grit my teeth and get through this and just really crush that muscle and crush that trigger point, then it'll all be okay. And really what that does is it spikes your pain up. The muscles can have a rebound effect where they clench even tighter because it's a really unpleasant, noxious experience. And so that's my philosophy, is just that we want to be gentle and be working with the muscles and not forceful and working against them.
Yeah, so smart. So are there any kind of exercises that you would recommend that are like actual physical, like yoga exercises, right?
Yes, I do. I have a couple that I recommend, and usually when I'm working with a patient, when it comes to pelvic floor relaxation, I think everyone responds differently to different body positions that just feel better on them than others. And so I usually show them about four and let them pick their favorites from there. And so my top favorite pelvic floor release positions, and it's not, I mean, it's a bit of a stretch, but it's more about getting the position of opening in through the pelvic floor. And that includes deep squat. So you can use a kitchen counter, you can use a door, and you're just dropping down almost like a caveman. And that's just going to naturally open the pelvic floor. And you can work on breathing into your rib cage, maintaining it for 2 to 3 minutes. Another great one is child's pose. And I actually like to provide modifications to that. So if you can picture child's pose where you're kind of on your knees and you're folded over, some people call it a shell stretch too, where you're kind of curled up like a child ready for a nap. You can put a pillow in the back fold of the knees to boost your rear end a little bit for people that have hip or knee tightness. But interestingly, that little boost can also bring a little bit more of a relaxation around the vaginal opening and around the tailbone, just by providing that little bit of boost within opening the knees. You can also put that pillow in the fold of the hip in the front, and that's going to lift your chest up a little bit. And that's really helpful for people that have back pain. And additionally, you may feel that a little bit lower in through the tailbone as well. So you can modify the position to change how it feels on the pelvic floor. Happy baby is a great one, where you're laying on your back and you're propping your feet up towards the ceiling. What I find is that if anyone has any hip impingement or hip pain, that one doesn't tend to feel super great for them. But what
Usually
you
hurts.
can, yeah, it does. I'm one of those. I've got a
Same.
little labral tear, and it's a very provoking exercise for me. But one thing that you can do to change it is get into that happy baby position where you're on your back and your feet are up. And instead of having them, the knees pulled up towards the chest, you can actually prop them up open a little bit against a wall. So the feet are on the wall and you're still in a little bit of hip flexion, but that's a really nice opening position too. And then additionally, being in that cat and camel or cat and cow position and working on just moving the spine in and out of extension can be really helpful for the pelvic floor as well.
Amazing. Yeah. Because, like, one of the interesting things about the pelvic floor that I don't think a lot of people realize is that it's all connected. Like, everything in your torso is connected, right? Like your psoas muscle,
Yes.
like your diaphragm, like all of it. So, like, breathing can affect your pelvic floor. Stretches that don't feel like they're stretching like your vagina area can affect your pelvic floor. And so it's really important to, like, I don't know, I love yoga.
Yes, and you got it. And all of that is super important too, because if you've got other muscles above the pelvis that attach onto it, like your low back and your psoas, as you just mentioned, that are tight or restricted or that you don't have good control of, that can also impact how your pelvic floor behaves and the coordination of your pelvic floor as well.
Amazing. Thank you for all of that. Um,
Yes.
so if somebody had like deep pelvic pain, what would that be caused by, and how would they go about managing like the deep pelvic pain?
Yes, that's a great question. And so in people with endometriosis, certainly deeper penetration can be caused by the endometriosis itself, that tissue, as it connects into and around musculature, tendons, all of that. So that can be a driver, certainly. And that would be something that we would be looking at managing with the help of a very skilled doctor or surgeon who could possibly do excision. From a physical therapy standpoint, possible drivers can include trigger points or tender points within the pelvic floor muscles. So like a knot, essentially, just like you get in your neck or in your back, and you push on it and it zings up and over your head and it's very, very painful. those pelvic floor muscles are muscles just like everywhere else, and they can be too short. They can be too weak. They can also be short and weak, and they can also be too strong. They can be overactive. And I liken it to, if you just chronically walked around with your shoulders in your ears, you would have a headache all the time, and these muscles in the upper tracts would be very strong and very, very big, and they could have knots too. And that can certainly happen in the pelvic floor. And for people that have endometriosis, that are in a lot of chronic pain, guarding by clenching and contracting those muscles is a very common response. So we tend to see those things going hand in hand. So management would be in physical therapy, identifying where those are and doing certain manual techniques to help relieve them. I have a really special thing to show you. You're actually the first person that gets to see it.
Oh my God.
So
Yeah.
are you so excited? I
Yeah.
actually made this. So you know that I made the wands to help manage deep, tender point pain on their own, where the purple one is our original wand. The turquoise one vibrates. In honor of endometriosis, I've created a yellow one that is hot and cold therapy. So this one can actually go in the freezer, or you can put it in a hot water bowl and it can warm up, so people can be using different temperature therapy. So we wanted to make a hot cold one, and in honor of endo, we've made
It's
it
yellow.
yellow.
Oh my
It's
God, that's
endometriosis
amazing.
yellow.
Oh
So
my God,
I'm
so
super
cool.
excited. I've been saving it for you. We have not released this yet. It's going to be available on our website in a few weeks, but I saved it for you. So
Yay.
anyways, the wand can be used to be able to come in the vaginal or rectal canal. Either end can go either way, and can be used to provide that gentle tomato touch compression, just like you just said. So we're never pushing with anything any harder than we would use to check a tomato for ripeness, and then allowing it to sit there for a minute or two and helping to dissolve that tender point. So,
Oh my
and then
God.
doing some myofascial release. So yeah, this
So
is our hot
fun.
cold one. Yes. So the vibrating one has 10 frequencies of vibration for people that respond to that soothing. And some people, especially with endometriosis and inflammatory states, putting this in the freezer for, a day. It can live in the freezer if it wants, and just wipe it down, wash it, and then be using it to help with therapy there. Or for people that respond better to warmth, running it under the faucet under warm water, and then using it warm. So
that's amazing. Thank you so much for sharing that with me. And that's so important, because you're right. Like, people respond differently to different things, like vibration, cold, hot,
yes.
like amazing. That's amazing.
We
I'm
are
so excited
all
for you.
unique. Yeah, for me, I'm very adverse to cold. My body does not respond well. It's not for me, but I have patients that it is their saving grace. That is the thing that works for them. So, it's our newest helpful tool to help people get what they need.
That's freaking amazing. So everybody, you can go get that at her website at
Yes,
intimaterose.com.
intimaterose.com. Yep.
Fantastic. I'm so excited about that.
Yes.
Amazing. Okay. So using the wand obviously can help the deep pelvic pain. I also know that, and this I guess isn't really related to pelvic floor PT, but like more foreplay can cause those muscles around the uterus to contract, raise up, which elongates the vaginal canal and brings, if you do have adhesions and endometriosis, it brings the uterus up and away from the penis. So there's less room to get jarred,
Absolutely. And one thing that I always say is that it really is a warm up, like foreplay, just like you would warm up to go to a yoga class, or like an athlete would warm up to do their sport. And for most people with vaginas, 45 minutes is physiologically needed to get all of the blood flow and the tissue relaxed, and to get that full response like you just perfectly described, to be ready to have pain-free intercourse. So I think a lot of times, especially like if our partner is in a hurry and we're in the heat of the moment, things get rushed and that full physiological process doesn't take place. Maybe even like emotionally or mentally, we're not prepared, in addition to what's happening with the blood flow and the circulation and all of those good things. So it's important to just be really, really patient and allow that warm-up period so that you can have your muscles be fully ready. And so dilators are one method of training for that response as well. Dilators can be used under arousal type circumstances or in the absence of, to help train the muscles and train the tissue as well. And that's, I think, a really good way to practice when you're in a controlled environment and when you're in control of yourself and the dilator. And it's like practicing for the real thing.
Yeah.
and also having just really strong communication as always, and really letting your partner know when you need a little more time.
Yeah, 100%. And I know, like I always say, at least like minimum 15 minutes
Yeah.
at least, but the 45 minutes would be amazing. So, I mean, you can, and it doesn't have to be with your partner if like they're in a rush, right? Like you can get yourself ready.
Yes, absolutely.
Yeah.
Absolutely. That can be broken up. And, I know for a lot of people, they might hear that and think, well, that removes a lot of the spontaneity and those kinds of things. And, it may be that at some point you don't need that much time and your body changes and whatnot, but different things in life, different circumstances, hormone changes, stress, life events, all of that can impact our body's sexual response, and especially in people that have vaginas, because our circulation is just a little different.
Yeah. And it's different, like in different stages of your healing journey as well, right? Like you might be in so much pain that it just isn't even a possibility or consideration right now. And that's okay. It, like we're humans and you don't have to be like constantly turned on all of the time. I mean, can
Yes.
be, but you don't have to be.
Absolutely. I actually had a talk with a sex coach a couple of months ago, and she brought up this really amazing notion of pleasure doesn't necessarily have to come from penetration. I think we associate it with that a lot of the time, and certainly that's one way of bonding. But there's a lot of other really fun, and she said it so perfectly, fun and sexy. It can still be sexy. You can still feel sexy and be sexy doing other things, and that is awesome.
Yeah.
That's a great goal.
It is a great goal, and it's okay for things to be different. Like different's good.
Yeah,
It doesn't have to be a
absolutely.
bad thing. And your pleasure is your own, it's your birthright. Like you deserve to have pleasure and for it to not hurt, and if it does hurt, like having the tools necessary to figure out how to manage that pain.
Absolutely. Absolutely.
Do you have any like fun positions that you would recommend for somebody with endometriosis that you
Yeah.
found that are like less painful?
I do. I have a couple of recommendations. And again, it does come down to the individual as to like where those adhesions and things are located. A general blanket statement is that for a lot of people with endo, a helpful one is the spoon position, to where you can be laying on your side, partner behind, and the top leg is propped up on a sleeping bag or some pillows and things like that. That helps to open the pelvic floor. That also helps to decrease the depth of penetration a lot of times. And it kind of also puts you in a position to be able to control clitoris and other things happening in the front that can be conducive
Yeah.
to arousal and orgasm response and all those other good things. So I find that by and large, a lot of people really enjoy that have had pain with intercourse. I also advocate for being on top, where you can control rate and depth of penetration. And there's a lot of different hip positions within that. You can think of like the traditional you on top straddling a partner position. You can also bring the legs down so you're a little bit more flat and the hips are not spread wide. And that can create a little bit more of a shallow experience too, to where you can control it. But by being on top, you can control that rate and depth, which is really empowering and helps you to like put yourself in a position for success. And then for some people, they'll respond well to being on hands and knees, but for some, again, it comes down to that unique individual. There may be adhesions right in the front wall that are getting bonked. So I highly recommend having a lot of different options in your kind of playbook,
Yeah.
in your
Same.
role, in your mental, repertoire,
Mhm.
and just be ready to like change position on the fly, because something may feel good one day and maybe not feel as good the next day too, just depending on hormonal state and arousal and things like
Where
that.
you are in your cycle, like so many things. And I know, I agree, like sex gets to be fun and playful, and changing positions often can be fun, and figuring out what new positions you like and what actually feels good is so important, like getting curious about your own body, you know?
Exactly. I love that notion of like being curious. I think especially after this last year where we fall into like our patterns and things and our world has kind of become very, very small, is to become curious about other aspects of our life. So I think that's a great way of putting it.
Yeah. Um, I guess, let's chat about like products that you love that you recommend. Cause I have a couple that I recommend all of the time, but I'm curious at what you recommend.
Absolutely. So in terms of like sexual health, our vibrating wand, while made to be a helpful tool in musculoskeletal management, it vibrates. So, it's a vibrator by any other sense of the word. So if this is held, in and around the clitoris and in and around other areas, can certainly be used to heighten arousal and achieve orgasm if that's a goal. Our dilators are a helpful tool to help prepare and train the muscles and train the mind for penetration. In conjunction with that, a product that I love that is not ours is ONUT. It's another tool that has stackable rings. It goes on the penetrating partner's penis, and depending on where you are that day, and it could fluctuate, it could ebb and flow. It may be that you need all the rings on to make for more shallow penetration, and then you might be able to take them off even within session, or on a different day, and so it allows for deeper penetration. So it's a really nice stepwise progression.
I love that thing.
Yes, it's a
So cool.
great tool.
Yeah.
Great tool. Those are my favorites off the top of my head. What are your favorites?
I always recommend CBD lube.
Oh, yes.
Yeah.
Yes.
I love
Yes.
CBD lube. Like it doesn't have THC in it, right? And so it's no like psychoactive or whatever, but it still
Yeah.
provides the same relief that like the cannabinoids do. So like the pain relief, heightened arousal because it stimulates the blood flow to that area more. It's game changing.
Yes. Go Love has a really good one
Go
that's like a
love.
really nice, Go Love CBD. Yeah, they do a good job.
I love the one by Kush Queens.
Okay.
Yeah.
I think I did see that on a website somewhere.
Mhm.
That's good to know.
Yeah. And Foria Wellness also has like a bunch of, they have an Awaken, I think it's called, or it might be confusing. Yeah, it's Awaken by Foria. Theirs is
Oh,
amazing.
oh, that's great.
Also like vaginal suppositories, CBD suppositories are awesome for just like relaxation, but also they have intimacy ones Foria Wellness does.
Oh, that's great to know.
That you can
Absolutely.
use
And some,
vaginal or rectal, whatever.
sure, absolutely. And some physicians can prescribe some that are a little bit more ramped up that may have lidocaine or Valium, even in some cases, to help relax the muscles. But that would be prescriptive basis.
Yeah,
But
from
for
your
some
doctor. Yeah.
people, it can really help them turn the corner.
Oh wow. I guess I didn't realize that. That's really cool.
Yes. Yes. It's like a chill pill for the vagina.
Basically, yeah. I love that. That's like all I can think of off the top of my head because I always recommend the ONUT. Any kind of like vibrator that you like, right? Or that feels good, and CBD loop. And then
Yeah,
time,
those are,
lots of time.
and time
Yeah.
and patience, which is
Mhm.
super hard.
It is hard, but like you said, it might take a little bit longer in the very beginning, but it might not always be like that. So it's about getting curious and accepting that this is your now, and it might not always be that way, you know?
Absolutely. That's so perfectly put.
Yeah. And I mean, it's just like anything else. If you're training your muscles down there, just like you're training like your biceps or whatever in the gym, they'll relax over like the more that you do it, the more consistent you are, like things will get better.
Absolutely. Just showing up for yourself.
Yeah. Yeah. Is there any other like tips or tricks or things that you wanted to touch on about managing pain with sex?
No, I think that that's it. Just having a good team in place, using tools as as you're going through your process, reaching out for help and having good support. And we are always available to help provide support. Anyone can email us at support@intimaterose.com as well. And we can help partner people with pelvic PTs in their area. And then we've got the resources up on our blog as well.
Perfect. And I will link everything below so everybody can
Perfect.
find you, because you're just an angel.
Oh,
You're so sweet. Thank you so much for coming on. This was amazing.
oh, thank you so much for having me. I always love being on with you.
Of course. We'll see you soon.
Okay, sounds great.
Bye.
Bye.
I hope you loved this episode as much as I did. If you are new to this, welcome to day 1 of the training of my Endo Empowerment month, my Endo Empowerment series for Endometriosis Awareness Month. So every week, I'm going to be hosting 2 trainings. It's going to go in my YouTube, on my podcast, in the Facebook group. If you aren't in the Facebook group, go ahead and click below the podcast episode to join. There's a link to join under the YouTube video as well. To get in the groups to watch them forever, obviously they're going to be on my podcast and YouTube forever as well. But thank you so much for joining me today. I hope you got a lot out of this episode and this training, and you feel a little bit more empowered in your healing journey with endometriosis. I'll catch you on the next one.